So I'm going to clean our catalyst machine. So the first thing I'm going to do is on the screen, I'm going to go to Tools, and I'm going to choose Clean Analyzer. And it does give me some instructions on here as far as what to do. So then I'm going to open the access doors, push up on there, and then when you push down, they kind of lift and you can raise them up. I am using lint-free optical tissue, and I have some 70% alcohol. Just grab one. The first thing you want to do is you want to remove the black carriers. And then of course if you have a sample cup in there, make sure you don't have any of the small little serum cups. You do want to get rid of those. So I'm just going to dampen my tissue, and then I'm just going to kind of wipe everything down. I'll just set them off to the side to kind of dry some. And then you also have the white centrifuge shield right over here that you need to get out and clean. And then you can put everything back in. So the next thing that we need to do is we need to lift the sample drawer, and there's in the center, you push in on that, and it kind of unlocks it, and then you can kind of lift it up. And that's going to give you access to the carousel that's underneath, so we're going to remove that next. Alright, so we're going to get a clean piece of tissue that I'm going to dampen, and what I want to do is I want to wipe down the ring, and I'm going to skip over the ion window and skip over the optic window, and I'm going to go in a counterclockwise direction, and I'm going to do this about 3 times, and I'm going to get a new wipe each time. Just wipe it, and then when you get to the ion window and then the optic window, you just kind of skip over it. We'll come back and clean those separately. And then I'm going to get, with a clean wipe, I'm going to come back and I'm going to dampen my wipe, and I'm going to wipe down the ion window, the optic window, and then also the white reference tile that's on the carousel itself. And then this time with a dry tissue, I'm going to come and wipe all 3 things again, kind of make sure there's no smudges or smears or anything like that. So I'm going to wipe with the dry tissue, the ion window, the optic window, and then the reference tile on the carousel. And so then we will put the carousel back in, and you kind of have some arrows to kind of show you how it goes in. Alright, so we got the sample drawers in place. At this point, I kind of like just to wipe everything out one more time right here. And then at this point, you can close the access doors. Just push down on this and then they'll come down. And then sometimes I have to lower one side. And then you're going to hit done. And once you finish this, you do need to initialize, or it's going to do it automatically. It's going to initialize the system, and it's going to take about 15 minutes. This, after it gets done, if you have quality control panels, you can run those next. We do not have those, so at this point I'm done. And I'll come and clean the outside. Sometimes we end up with little splatters of blood everywhere. And that is how you clean the catalyst. I'm about to run a heartworm test. It's an ELISA test. I've got some blood. This is in a heparinized needle. And what I'm going to do is I'm going to put just one drop of the sample in the little well right here. Okay. And then I have the buffer. And it's going to be 2 drops. And then I need to let it sit for 10 minutes. And so I have a timer. And I'll press that. And then we'll come back in 10 minutes. Okay, so it's been 10 minutes, so then we're going to look at the test, and what we are checking is we can see that we have the control line, so it's ran correctly, and then we look under the test line. If there's a line there, then we know it's positive. This one does not have a line, so we know that he is heartworm negative. So the first thing I'm going to do is a fecal flotation. What I have is a cup to mix everything in. I have another fecal cup that I will strain my sample into with some gauze. I have some fecal solution, cover slips, a slide, and of course 2 grams of a sample. So the first thing I'm going to do is pour some fecal solution into this cup, and then I'm going to thoroughly mix my sample. And then I'm going to take some gauze and lay it over my cup, my sample cup, and then I'm going to strain this mixture into it. And then I'm going to take my fecal solution and fill this up to the top until a bubble or meniscus forms. And then I will take my cover slip and I will set it on top, and then I'm going to let this sit for about 10 to 15 minutes, and then I'll come and check it. So it's been 15 minutes and my fecal solution has set. So what I'm going to do is I'm just going to carefully lift the cover slip off and put it on the slide. Okay. And then I will come to the microscope, and I'm using the 10x film, or sorry, 10x lens. And once I get it zoomed in, I start at the edges, and then I kind of do an up and down S pattern. And I will continue to do this to look for, of course, parasite eggs and things like that. And if there is anything I'm suspicious of, I can certainly go up to the next size lens. And I will do this over the entire area on the cover slip. Okay, now I'm going to do a fecal flotation with the centrifuge. So I have cup to mix my thing in. I have, of course, 2 grams of solution. I have 2 grams of fecal matter. I have my fecal solution, some gauze, and I have a centrifuge tube. And so the first step starts out the same. I'm going to put some solution in my cup, and I am going to stir my fecal sample. Make sure I mix it pretty thoroughly. I I am going to strain it into a second cup simply because my tube is a little bit skinny. I have a tube that I'm going to pour this fecal solution in. I'm going to make sure to leave a small space at the top. And then I do need to make a counterbalance. I'm going to take my 2 tubes and set them up in the centrifuge, and I'm going to centrifuge them for 5 minutes, and I'll be back. So my fecal flotation has been centrifuging for about 5 minutes, and what I'm going to do is I'm going to put it back in my little tray, and I'm going to pour, add more fecal solution to it, and I'm going to do it until it forms a little meniscus at the top. And then I am going to take a cover slip on it and put it right on top. And I'm going to let this sit for 10 to 15 minutes just like a regular fecal flotation, and then I'll come back and check it. So this has been setting for about 15 minutes, so then what I'm going to do, just like a regular fecal flotation, is I'm going to carefully lift the cover slip and put it right on top of the slide. And then I will take it over to the microscope and I'll examine it under a 10x lens, just like I do a fecal flotation. Make sure I will scan the entire cover slip field, and I will go in an up and down S pattern. Now I'm going to do a direct smear for a fecal, and what I'm going to do is I'm going to take a little bit of fecal solution, cut a drop, and then I have a sample, smear it in there, and mix it all up. And then I'm going to make sure to get out any of the big chunks, and I'm going to kind of smear it to a single layer. And then I'm going to place a cover slip on it. And then I will go to the microscope, and I will examine it the same way I do a fecal flotation. I'll use a 10x, and I'll go from over the entire area, kind of in an S shape up and down, looking for eggs and anything else. Okay, so the next fecal type of sampling method I'm going to do is the sedimentation. What I'm going to do is I'm going to take my fecal sample. I have about 2 grams of feces, and I'm going to mix it with just some regular tap water. And I'm just using the tongue depressor to mix it. And you want to make sure you thoroughly mix it, and then the next step to do is to strain it. And then it's going to go into a centrifuge tube, and it's going to centrifuge for 5 minutes, or you can let it sit for 30 minutes. So I'm going to go get this centrifuged for 5 minutes, and then I'll be right back. So my sample has finished centrifuging. So what I'm going to do is I'm going to pour off the super dad without messing up the sediment at the bottom. I'm going to take my pipette and grab the top layer on the sediment and put some on my slide. I will put a cover slip on it. And then I'm going to examine it under the microscope, and I'm going to use the same technique that I used for all the other ones, kind of in a S pattern up and down, and I'm just looking for any eggs, especially fluke eggs. Okay, so I'm going to do some lab work using our catalyst machine. The first thing I always like to do is we always like to empty the drawer. And then it's going to ask me if the drawer is empty, and I'm going to put yes. So I've already put all the information for the patient into the computer, so it should be popped up right here. So I just click the patient's name. It's going to ask me what sample type I'm going to use. We have little special heparin cups, so we're using plasma, so I'm going to choose that one. Click next. Then it's going to open up my drawer. Get rid of what's already in there. Sample cup goes here. You gotta remember to pull off the blue tab. And then I'm doing lights and a Chem 17. We like to put our lights on the bottom. And then I just kind of fan them out. And then we will put our Chem 17 next. And again, just fan it out. Once you've got everything set up, you just press run, and it will run in about 10 to 15 minutes, and then I'll come back and check it. So it's been about 15 minutes, and when the lab work gets done running, all it does is it prints off a little sheet off of the printer that has all the results, and then we are done. To get do an ear cytology on Lexi, so I just have a couple of cotton applicators. I like to kind of make one to look like an L, so I know that's the left ear, and then you just pick up the ear flap, and you want to get, you know, inside the ear, not have to go too deep, but you just kind of get against the wall and roll it. Great. So there's my right one, and then I'll do my left one. Turn around. And again, just go in the ear a little bit and roll. And then I will go set these up on a microscope. So now I'm going to prepare my ear cytology. I'm going to stain it and prepare it to view under the microscope. So this is for the right ear, and I like to make 3 rows, and you want to roll it. You don't want to smear it on there. You just kind of roll it on there. I do my right and my left on separate sides, so I always like to put this one face up on the right side, so I remember that. And then I'm going to start dipping it. And again, we like to do a certain number of dips into each color, so I'm going to start with blue. And then we dab it in between. Then we will rinse it. We'll just rinse it till the water runs clear. Alright, that's my left one, and then I'll come and do the same thing with my right one. Here are my ear samples. I'm going to do my ear cytology, and I have my left and my right slides. And if we'll just look at the left one on the microscope lens, on the microscope, I'm on a 10x lens, and the first thing I do is I like to make sure I get it in view so that I can see some of the purple in there. And once I have it in view, which it is, then I'm going to do an oil immersion. So I'm going to take my oil and put just a drop right in the middle. And then I'm going to the oil immersion lens, and I start from the shortest one to the oil immersion. And get it in the oil. And then you're going to have to do a little bit of adjusting with the light, of course the magnification. And what we're looking for on ear cytology is we're looking for yeast and bacteria, and then sometimes you'll even see blood cells on there. And we usually do a count of the number of yeast, the number of bacteria, and what type, like 1+, 2+, different amounts like that. And you'll usually see skin cells, epithelial cells. So I can see immediately that she's got quite a lot of cocci, which is a bacteria. And in this particular case for the cocci, I would say too numerous to count. And the cocci they're really small brown things. They're usually in groups. Of course, you may see rods, which is another bacteria bacillus. And then yeast, a lot of times they're in the budding process, so they kind of look like peanuts. I'm not really seeing any yeast on here. I'm not seeing, there's a couple of white blood cells. The main thing with this one is bacteria. And that's how you do an ear cytology. And of course you could do the same thing with the other ear as well. Do a necropsy. The doctor's going to do a necropsy on a rabbit. So what we have as far as protective gear is we do have face masks, some disposable gowns, and then some latex gloves. And the tools that we're using, since we're doing a small animal, we just have different size scissors. We have needle holders in case we need them. We have some plastic thumb forceps. And then, because we're doing a small specimen, we have just a regular scalpel. And then to cut the sternum, because it's so small and the sternum's not very big, we have this wire cutter. So those are the tools that we're going to use to do our necropsy.
Alright, we're going to start our necropsy on this rabbit. First we start with an external exam. Look for any signs of hemorrhage in the eyes. The mouth, see if there's any blood or any discharge or ingesta. Any broken bones, broken back. You see this is a male bunny rabbit. Now we get him a position for using on his abdomen. Make a midline incision from the mandibles all the way down. We're going to examine the chest cavity first. Examine the trachea, and musculature. Make a Y-type incision to get to the sternum. Now I'm underneath the sternum, I'm going to use some wire cutters to cut through the sternum to open the chest cavity. Open the chest so I can examine the heart and the lungs, which the lungs are very congested. No signs of any blood in the cavity though. I take a lung biopsy to put in formalin. Just a small sample from one of the lung lobes. Put it in 10% formalin. If there's any sign of any atelectasis, I will send off a fresh sample for culture. Next is the heart. Actually, I usually remove the entire pluck, but in this case I'm just going to exteriorize the heart. Nice normal size. I usually cut the heart lengthwise to look at the chambers. Make sure there's no valvular disease. Side looks normal. Nice normal musculature. A little thickened on the left, but normal musculature and normal valve structure. You can take a heart muscle sample. Onto the abdomen. Alright. First the liver. Nice normal structure. There's our bile duct and our gallbladder. I'll take definitely a good portion of one of the liver lobes for biopsy. Alright. Then we go onto our stomach. Normal size, and then I run the bowel. Start out with the duodenum. Very dilated, gassy ileum. Our cecum's over here. And we go down to the colon. No signs of obstruction. And then I usually take a sample of the stomach and each of the intestinal loops. I pull back to look at the kidneys, nice normal size. I exteriorize them so I can cut them lengthways to examine the structure of the renal pelvis. No signs of any problems with the glomerulus. There's our pelvis in the middle. And I do that on both sides. Usually take samples of each. Crosswise sections. Remove it from the capsule and then cut lengthwise to check the renal pelvis. Normal signs. I also, before we finish, I do make an incision in the stomach to check for any signs of ingesta that may have been a problem. Nice normal rabbit food and no signs of obstruction. And I take samples as I go of the ingesta as well.
So as far as
The doctor to discharge.
tubes that we used, you just want to make sure, normally if this had been a patient of ours and we were sending it to like a state lab for a histopath, we could print off labels from our computer Avamark system that has the patient information, the client information, the hospital information. But since this is just a rabbit that we were using, we don't have that information, we don't have that label, but you would normally put all that on the label, and then you would want to put what tissue samples are in the container. So in this case, this is where we put our heart tissue sample and our kidney tissue sample. And you want to make sure that that's on all the formula jars that you send. So how we handle rabies cases at the clinic, the only person that's allowed to actually obtain the sample is the veterinarian. And anybody that's in there that needs to handle the sample needs to have gone through rabies prophylaxis. What you would wear while you're getting the sample is they need to wear a gown, they need to wear a mask, they need to wear gloves, just your standard protective equipment. This type of sample that we send depends on the size of the animal. If somebody brings in a bat that we're to send to the state lab, we usually just send it whole, but if we're dealing with like a cat or a dog, the only thing that we send is the head, so the veterinarian will cut the head off, and that's what we would send. The way that we send the sample is we do have to wrap it in a leak-proof, waterproof kind of zipper-type bag, and we have to do that twice. It has to be double bagged. Our state lab prefers that we send the sample refrigerated and not frozen because of the thawing issue. So when we do send it with some ice packs. We never use dry ice for that. And to what we do with the rest of the bodies, we also send it to the state lab, and they run it through their, they use a digester instead of an incinerator, but uses chemical to decompose the body, and that's how we handle rabies.
Okay, so we're going to get a vaginal sample for a vaginal cytology. The first thing that the doctor's going to do is she is going to wash the vulva area. And then she's going to moisten her cotton tip applicator. She's using sterile saline. And then she's going to insert at an angle, and then once she gets in, we'll go up.
Okay, honey. All right. Okay, here we go. We got it.
And then she rolls it around in there to get some cells. Okay, let's see, we're done. And then she'll roll it on the slide. We're not going to smear it on the slide, we're going to roll it on the slide.
I'm ready to stain my vaginal cytology sample. I've let it air dry a little bit, and then we're using a dip quick. So I'm just going to take my slide. I always want to make sure I keep, notice which side is up, and put my little clip on it. And then I'm going to dip it into the blue one. We like to dip for a certain number of times, and then I'll do the red, and then I'll do the purple, and I'm going to kind of blot it in between each one. So I'm going to dip it into the fixative first. blot it. And then I'm going to go into the red stain. Blot it. And then I'm going to go into the purple stain. And then what I will do is I'll take and I'll rinse off the excess stain. And then at this point I can look at it under a microscope, which I will show you next. So now I'm going to look at the vaginal cytology sample. What I'm going to be looking at is what type of epithelial cells are there, red blood cells, if there's white blood cells, if there's bacteria. And I'm going to start out on 10X. And as I am scanning the slide, I am seeing a lot of nucleated cells, basal cells, intermediate cells. Some of them are round and oval, some of them are polygonal. And I'm seeing a lot of red blood cells on here. And I'm seeing quite a few white blood cells, and I'm seeing some stuff that may be bacteria. So if you need to, you can go to 40X to get a closer look. And I definitely see some rod-shaped bacteria. So based on what I'm seeing on the microscope, I would say that the dog is in proestrus, which is the stage of the cycle that there's usually a red tinge discharge coming from the vulva. The next stage of the cycle would be estrus, and this is known as heat. This is when the dog is receptive to the male. On the microscope, what you would see is a lot of anucleated cells. They're superficial cells. They're keratinized. You may see some bacteria kind of attached to the cells. Really won't see any red blood cells or white blood cells. The stage after that would be diestrus. And in that stage, there's a shift back to the basal cells, the nucleated cells, and you may see some debris on there, cell debris. Really won't see any red blood cells or anything like that. And then the stage after that is anestrus, and in that stage it looks very similar to diestrus. You won't see any debris or anything. You may see a few red blood cells. In both stages you may see a few red blood cells and things like that, but you really won't see any superficial, they'll all be nucleated. You won't see any keratinized cells or anything like that. And those are the 4 stages. Okay, so I'm going to do a skin scrape on Lexi here. And I have my slide, and I'm going to put a drop of oil on it. And then I have my blade. I'm just going to kind of run it through the oil. Alright, and then I'm just going to find a good area. And then you're just going to scrape it. And you want to scrape it until you draw blood. And then once you get to that point, you just take and kind of wipe it in your oil, and then we'll go look at it under a microscope. Okay, so I'm about to look at my skin scraping sample, and this is just from one location that I did. And so as you're examining it, you'll see a lot of just debris. You just kind of jump from the skin. And I do try to go in an orderly fashion. You will also see some hair follicles. And you should see a little bit of blood on there because you've scraped deep enough to get to the blood. And the main thing that we're looking for on a skin scraping is mites. I did my skin scraping on a dog that has had a history of Demodex. really seeing any mites on here. So I did not see anything on her skin scraping. Okay, so what I've done is I've placed some blood into 2 serum separator tubes, and then I'm going to, make sure they're properly labeled. Then I'm going to take out the serum and just pour the serum out and get rid of the rest of the tube. And so I have a plain red top tube labeled here for donor and for recipient. And then I'll come back and use these when I get to the major and minor cross matching and setting up my controls. Okay, so I am going to start making my herbicide wash, washing my red blood cell count. So what I have is just a purple top tube that I've spun down, and I'm going to get rid of the plasma. That's for my donor sample, and I'm going to do the same thing for my recipient sample. So in a red plain top tube, this is just a 12 by 75 milliliter tube. I'm going to take my donor sample, I have this one labeled donor, and I'm going to grab 1 or 2 drops of blood. Regular sodium chloride, and I'm going to fill up the tube with sodium chloride. I'll shake it gently, and then once I prepare the other one, I'm going to centrifuge them for 1 minute at 3,400 RPMs. Do the same thing with my recipient. So we get 1 or 2 drops of blood. Fill the rest of the tube with saline. Sodium chloride. And then I'll go spin them and come back once I get that done. Okay, so my little erythrocyte washes have been spinning for a moment. They spun for a minute, and now what I'm going to do is I'm going to decant all the supernatant. And then I'm going to fill it back up with saline and I'm going to spin it down again for 1 minute. And I'm going to repeat this one more time and then as much as necessary until the supernatant is completely clear. So again, all I've done is filled it back up with saline or sodium chloride, and I'm going to spin it for another minute, and I'll come back and repeat that process, decant the supernatant, fill it back up, spin it again, and then I'll do that as many times as it takes to get completely clear supernatant. I'm ready to make my actual suspension for my red blood cells. So I have another clean tube. And I'm going to put, it's a 2% suspension, so I'm going to put 0.98 mLs of regular sodium chloride, which is what I have here. And then I'm going to take my recipient washed red blood cells, and I'm going to pull up 0.02%. And I'm going to do the same thing with my donor. That will be my 2 red blood cell suspensions. So at this point I'm ready to do my controls and my major and minor cross match. And so I have some tubes labeled for each one. So for my major cross match, I'm going to mix 2 drops of the recipient serum with 2 drops of the donor's red blood cell suspension. So I have the recipient serum right here. It's just 2 drops. And then I'm going to grab my donor cell suspension and do 2 drops of that. And that will be my major cross match. For my minor cross match, I'm going to do 2 drops of the donor serum with 2 drops of the recipient red blood cell suspension. I've got 2 drops of serum. Two drops of suspension. And that's my minor cross match. And then I'm going to set up my controls, and in your controls you're going to mix the recipients, both the serum and the suspension. And that'll give you your recipient control. So I'm going to do that. And I'm going to mix it with 2 drops of the recipient suspension. That gives me my recipient control. And then for the donor, I'm going to do the same thing just with the donor stuff. So I got 2 drops of the donor serum. With 2 drops of the donor suspension. So at this point, I've got to let them sit for 30 minutes, and then I'm going to spin them for 1 minute at 3,400 RPMs, and then I'll check the results at that point. Okay, so now my major and my minor cross match and my controls have sat for 30 minutes, and I've spun them down for a minute in the centrifuge, and I'm ready to examine them, and I'm just going to examine for hemolysis. And I'm doing my controls first. So I'm not seeing any hemolysis in the controls. I am, however, seeing some in my in my major and minor cross batch. So there's some obvious hemolysis there. So the next step is I'll go to the microscope and I'll examine them at that point. Now I'm going to do a microscopic examination of my samples, and I'm using the major cross match right now. And I already have it set up on the slide on the microscope. I just took a drop of blood and put it on the slide, and I put a cover slip on it. And I played around with the settings until I can get a good contrast. And so what I'm looking for is some agglutination of the red blood cells. And I'm just on 10x right here. And I'm looking for grape-like clusters. If it looks like a roll of coins, that's something different. Here I'm looking for grape-like clusters. And if I see any, that tells me that there is some agglutination going on, which it looks like I'm seeing some. And then I'll do this for the minor sample, and then the controls as well. So I've done the microscopic examination on all of my controls, and as well as my major and minor cross match. I saw a lot of agglutination on the major cross match. I did not see any on the controls, so that tells me that these 2 animals are not a match for blood type.